Hello everyone, my name is Efren Colasso, and in this video I'm going to show the posterior to anterior hip mobilization with the hip in an extended position. This mobilization is indicated for patients that present hip osteoarthritis, knee osteoarthritis, hip pain, knee pain, lumbar spinal stenosis, and lower pain. So in this mobilization, the patient would be lying in a prone position, and we are going to work in the ipsilateral side. So in this case, our ipsilateral side would be the patient's left leg. So we're going to work in the left hip. The patient also would have a knee flexion, and it's going to be positioned properly. And if you can move a little bit to the side of the table, please. Okay. This is a better position for me to do the mobilization. For the clinician standpoint, we are going to work on the side. In this case, in the ipsilateral side of the patient, is going to be our left hip. In this case, with my right hand, I'm gonna position my right hand in the anterior medial part of the knee of the patient. Then I'm gonna be holding in here to have a proper stabilization. With my left hand, in this case, I'm gonna identify the radius trochanter of the femur. So once I identify, I'm gonna put my hands in that position, and then I will go with my hands directly in line with the greater trochanter. So with this position, we're going to try to do an anterior mobilization of the hip from posterior to the anterior part. So I put in my hand. It's important to have the table in a height that would be proper for us to do the mobilization. Also, flex my knees, be on top of the patient, so I'm gonna, and my elbow would be extended all the time. So I'm gonna use my body to do the force, okay? If you see, I'm using my body to do the transfer of the weight. I'm not pushing it, flexing my elbow. So stay here, and then with my body, I will do that. I can also do an alternative position of my hand. Instead of doing a cup position, and you can put your hand posterior to the greater trochanter. Then my fingers would be in line parallel to the popliteal fossa. So in here, I position, and again with my body, always do anterior translation. If we want to progress the level of the mobilization, we can extend a little bit more the hip of the patient, and then identify that line, and then I go and do the anterior translation. So that's it. That would be the posterior to anterior mobilization of the hip with the hip in extension position.